Yesterday, myringotomy, yes, myringotomy or tympanotomy. And what is a tympanotomy? It is an opening of the eardrum in areas which tend to heal readily to avoid spontaneous rupture at a site which rarely closes. Doctor, is myringoplasty the surgical repair of the tympanic membrane? Yes, it is. How is that done? By tissue grafts. Doctor, paracentesis tympani are surgical punctures, are they? Yes, punctures of the eardrum for the evacuation of fluid from the middle ear. Doctor, the stapedectomy is what? That is the removal of the stapes, reestablishing a connection between the incus and the oval window by interposition of the prosthesis and tissue or inert cover over oval window. Doctor, what about the tympanoplasty? The tympanoplasty is a reconstruction surgery of the sound conducting parts of the middle ear using skin grafts or veins or fascia or perichondrium and an operating microscope. And Dr. Exploratory tympanotomy of the middle ear through tympanomeatal approaches. Doctor, finally, the inner ear. Yes, that is decompressed, and there is a decompression of the endolymphatic sac. It is the removal of bone around the sac for improvement of the vascularization so that endolymph can escape to cerebrospinal fluid systems. Doctor, labyrinthectomy is what? That is the total destruction of the labyrinth with or without removal of Scarper's ganglion for intractable vertigo. Doctor, let me try some symptomatic terms on you. Very well, I have mentioned most of them in my medical report. Anacusis. Anacusis is a sound perception, as such completely lost. Auditory agnosia. Auditory agnosia is a sound perception at the end organ intact, but comprehension of sound lost centrally. Oral discharge, that is drainage from the ear. Impacted cerumen, that is dried ear wax. Cystagmus. Cystagmus or nystagmus is involuntary rhythmic movements in one eye or both, which may be horizontal, rotary, vertical, circulatory, oblique, or of mixed type. They commonly occur in vestibular diseases. Doctor, otalgia. Otalgia is merely pains in the ear, severe ear aches. Otorrhagia. Otorrhagia is a bleeding from the ear. Otorrhea. Otorrhea is a purulent drainage from the ear. Paracusis of Willis, that is the ability of a person with conductive hearing loss to hear better in the presence of noise. Presbycusis, it is an impaired hearing which is part of the aging process. Tinnitus. Tinnitus is a fancy term for ringing in the ears. Vertigo. Vertigo is an illusion of movement of an individual in relation to his environment. the patient feels that he himself is spinning, that is the subjective type, or the objects are whirling about him, that is the objective type. Central vertigo. It is present in disorders of vestibular nuclei, cerebellum, or brainstem, characterized by slow onset, prolonged duration, and absence of hearing impairment or tinnitus. Peripheral vertigo, that is the presence of disorders of the vestibular nerve and semicircular canals. It is episodic and explosive, marked by sudden violent attack, lasting minutes to hours, and usually accompanied by tinnitus and impaired hearing. Doctor, let me ask you about terms related to diagnostic approaches. Very well. Such as polytomography. Polytomography is a new technique of obtaining multiple serial section views of the ear, which are of diagnostic value. How's that?
It's okay.
You should get all those words in your dictionary, so if you get them, you get them.